One of the most common questions patients ask after skin surgery is, the skin cancer is tiny, why is my scar large, right? What you see on the surface is not always the full area that needs to be treated. When we remove a skin cancer, we don't just remove the visible spots, we remove a margin surrounding it. So, for example, we have a squamous cell carcinoma here. It's actually a large area, right? So, you don't know what's going on underneath this, if it's actually wider than what you see on the surface, right? Okay, so when we remove this, we're not just removing the visible spot, we remove a margin surrounding the skin. And there are research that have shown the right margin to remove based on the type of skin cancer, right? Okay. The size of the margin depends on the type. For many low-risk basal cell and squamous cell cancers, you may require a 4 millimeter of the surrounding margin. For a melanoma inside 2, which is often removed with a 0.5 to 1 cm margin, and then when we're talking about an invasive melanoma, a little bit deeper in the skin, you may require 1 to 2 centimeters margin depending on the depth of the melanoma. So a small skin cancer can quickly become a much larger surgical wound. So after the skin cancer is removed, a round wound is often converted into a long football shape, which I will show here in the diagram here. Okay, so let's say this is our skin cancer, this little purple area. Okay, and let's say the biopsy came back after we shaved this off, and now it comes back as a squamous cell carcinoma, well differentiated, right? So well differentiated, we know it's within that low risk. Usually, let's say it started out as a 0.5 cm, which is about 5 millimeter, right? Okay, so now how you get a bigger scar, because we're leaving a margin, and according to the criteria for a squamous cell carcinoma, usually you leave a 4 cm margin, a 4 millimeter margin, which is about 0.4 cm. So usually we go on both sides and we leave a good 0.4 on each side, right? Okay. 0.4, 0.4, and then now you have this bigger area that you're working with. But because we're going to be able to close this up and make the scar have a better cosmetic result, distribute that tension more evenly, and now we're going to make it into a longer football shape to help with our closure. So it's almost going to look like an eyeball right there. Okay, so now when we take our scalpel and we're going to cut this area along this line. Okay, along this line. So we cut that off. Usually we go like that, right? So we're cutting it off, and then we cutting this off. Okay, and we get our forceps, and we just lift that skin off, and usually we go down, because patients ask me, how deep are you going? Are you going deep into my bones? Not really. We're going into the subcutaneous tissue, which is the fatty layer, right? Okay, so I'm going to show you here what I'm doing. So we're picking this up and we're going down into the fatty layer, subcutaneous. So you lift that up, and then while you're there, you just gently, remember when you're doing this, the patient might be bleeding, so you probably will be cauterizing depending on the patient. All right, So you lift that up and you just gently slice away. And that's a little fatty area. Right, seeing that? All right. And also want to make sure you go down in there. So make sure you get a good depth of the skin cancer, right? Okay. Sometimes people can do a little suture here just to see where your orientation is in case it comes back that you have not adequately removed the skin cancer, which rarely is the case if you get a good margin, right? And usually you send this to pathology, and pathology will confirm and say margins are clear, and then you know that you've treated your skin cancer. So that's a basic excision, right? So we started out as this small skin cancer, and now we're going to have even a little bigger area. So for our closure,